Hello, Sandrine.
Hello.
When do you think the sexual impact of prostate cancer treatment should be discussed with the patient?
Well, clinicians should discuss it before the treatment, of course. And it's not only about discussing it, but it's also about informing the patients about the impact, the changes that he will have in his sexual life, maybe the partner's experience if he has partners, and maybe his couple intimacy. This is very important. Of course, we need to do it in a cultural sensitive way and make sure that we can talk about it with the patient. But we also need to acknowledge or to anticipate and tell him about maybe the possible psychological distress he might feel, the mourning on the losses, the sexual losses that he will have, and also to make him understand that we have solutions.
Could you explain who the healthcare professionals are who would be best helping this patient with the sexual concerns?
Well, mainly clinicians, because they have the first contact with the patient and they are going to give the treatment. However, if we need more care and counseling, maybe psychotherapists, psychosexual therapists that could consult, maybe also reproductive experts in case there is an issue with fertility. And it's very, very important to educate, to give correct information, and also to inform about possible sexual rehabilitation after the treatment.
So the guidelines ask that the conversation be inclusive. What is meant by that?
Well, the clinicians should be able to really take into consideration the cultural context of the patient and really be able to answer his specific needs. For example, if I'm talking to a heterosexual man, it's different if I'm talking with a gay man or a man who's having sex with men, or a bisexual man or a transgender woman, gender non-conforming patients, because each population has a specific need. And it's also about understanding the culture of the patient and really being open to everything and to show the patient that we are open and that we are here to really address their specific needs.
Mm-hmm. So individualizing.
Yes, exactly.
Could you tell me how you understand the kinds of barriers that healthcare professionals might experience when discussing sexual health concerns?
Well, first of all, they don't know how to do it because they lack the training and they don't have the time. And sometimes they're not comfortable about discussing sexual issues. And you know, there's a lot of cultural taboos surrounding sexuality, and they don't have the appropriate support or platforms that can be also culture inclusive to be addressing this issue in a really inclusive way. So these are really, there's a lot of barriers.
Can you give us an example how you might begin a conversation with a patient?
Well, it's very simple. You just tell your patient that at this point, when we do this assessment and prepare you for the treatment, I need to talk to you about something that is very important in your health and that will be impacted by the cancer treatment. And it's about your sexual life and your intimacy. Are you okay in discussing this? Because we want you to know everything about it, and we want you to know that we have solutions and we are here to walk you through this process. Are you willing to talk about it today?
That's lovely. Thank you.
Thank you.